I would enter the patient's room and introduce myself. Hi, my name is Michaela Kicklider. I'm a student nurse at the USA College of Nursing. I'll be performing tracheostomy suctioning today. So I would explain to the patient that I would be suctioning his trach tube. I would check the patient for any allergies and see that he's allergic to penicillin and see that it matches his chart that he's allergic to penicillin. I would position my trash can and I would provide the patient with privacy. I would then verify my orders and see that I am doing tracheostomy suctioning as needed. I would perform hand hygiene, and then I would check my 2 patient identifiers. I would see that I'm performing this on Mr. Jaguar Jones. His medical record number is 4176352, 4176352, and I would reassess him for any allergies and see that he's allergic to penicillin and penicillin. I would then check my saline expiration date and see that it's not expired, and I would gather my equipment. I would then position the patient. I would raise the bed to a comfortable working height, lower the side rail, and I would position the patient in semi-Fowler's or high Fowler's position. I would then don my PPE. First, I would do gown, mask, goggles, gloves, but today I did not have a gown, so I would just be doing the mask, the goggles, and the gloves, the clean gloves. For the video today, I will not be wearing the mask just so we can hear me speak. I would then, after I put on my PPE, I would then do a respiratory assessment on the patient. So I would auscultate for any abnormal respiratory rate, any adventitious lung sounds, any gargling, any nasal secretions, or any vomitous mucus from the mouth. I would also get a set of vital signs on my patient and assess for any irregular heart rate, any elevated blood pressure or pulse, any anxiety, any restlessness or anxiousness or anything like that. Then after I did that, I would do the pulse ox. So I would leave his SpO2 meter, his pulse ox, on his finger throughout the procedure so that way I could monitor his O2 and also his pulse rate. I would then turn on the suction regulator. I would turn it anywhere between 100 to 150 millimeters of mercury and not exceeding 180 millimeters of mercury. I would also turn on the oxygen flow meter to 100%, and then I would cover the patient. I would place a towel over the patient. Next, I would open my kit. And I would remove my clean gloves. I would perform hand hygiene, and then I would put on my sterile gloves. I would don my sterile gloves. After donning my sterile gloves, I would remove the saline from the canister, not touching the sides, and I would also remove the suction tubing. I would see before I remove the suction tubing, I would remove the lid. I would check the expiration date and see that this is also not expired. And now I would remove the suction tubing. And I would replace the saline back into the container without touching the sides. So now with my non-dominant hand, I will come and grab the suction tubing that's attached to the suction, and I would attach it to my catheter, my suction catheter, making sure that it is a secure and tight fit. I would place my non-dominant hand holding it, and then I would dip it in just to perform an accuracy check, making sure it's working properly, and it is. And then I would remove the trach collar from the patient, hyperoxygenate the patient, and I would do this for about 30 seconds, 5 to 6 puffs. So 2, 3, 4, 5. So I would hyperoxygenate the patient before the procedure, and then I would suction the patient. So I would dip it again to lubricate the tubing. And without touching the outer cannula, I would insert the tubing into the inner cannula. It's best to do on inspiration without suctioning. I would drop it into the inner cannula until I felt resistance, and then I would pull back 1 centimeter and begin suctioning. And I would suction only for 10 seconds, and I would do intermediate suctioning. And when I pulled it out, I would do this in a circular motion. And I would encourage the patient to cough. And then I would do this again. I would hyperoxygenate the patient between passes. So I would do 30 seconds of hyperoxygenating, 6 puffs, 1, 2, 3, 4, 5, 6. And I would wait a minute between each pass, and any cause for stopping would be if the patient's pulse dropped or elevated 20 beats per minute, or if the SpO2 dropped below 90%, or if it dropped 5% below the baseline. So I will perform the procedure again. So I will lubricate my tubing, and I will go into the inner cannula. It's best on inspiration. Go down until I feel resistance, pull back 1 centimeter, and then do intermediate suctioning. And as I pull it out, I would rotate it. I would do the suctioning for 10 seconds, no more than 15. And then, now that I'm done, I will again hyperoxygenate the patient. 1, 2, 3, 4, 5, 6. And I will replace the trach collar. I will remove my suction catheter from the suction tubing, discard of it in my glove, and remove my sterile gloves. This is done glove to glove and skin to skin. I would perform hand hygiene and put on my clean gloves. Redo my respiratory assessment, and on this respiratory assessment I would be comparing the findings in the post-respiratory assessment and the pre-respiratory assessment, just to make sure that I did this procedure accurately, and then that's it.